Our final practical will be on the 19th. Yep. So we have 2 more practicals after this one to continue and finish with the slides. I think I told you about your MCQ, which is on the 26th of May. My information also is that you are allowed to go to a pre-test there, and then if you don't pass it, you go to the retake session where you have the MCQ again. And if you pass it, you continue on the very date for your exam with the slides, the clinical assignment, and with the questions from the conspectus. That is how your exam is going to be. So, did I share this one? Yep. What organ is that? What structure do you recognize? Yep. How did you recognize this one? Tubules, proximal, distant, glomeruli, and some stasis of bile here, which can be observed. There is cholestasis again. So, these are the glomeruli with capillary loops, with the mesangial cells, with the Bowman capsule, with the Bowman space, with the proximal tubules, and with the distal ones, which are kept healthy. Changes here in acute renal failure, which is the thing that we're observing here, should be observed in the proximal tubules. Take a look at the tubules here. We see one which is with marked lack of nuclei. And we see some sort of granulate appearance of the cytoplasm, which is due to actually further necrosis of the cell, which actually will lead to necrosis of the cell and final death of the cell and disintegration of the cytoplasm. It's looking granulated because there previously has been here stasis, cellular edema, finally changes, finally lysis of the nucleus, karyolysis, and finally death of the whole proximal tubule, which is more appearing eosinophilic due to the disintegration of the organelles inside in the cytoplasm. This could happen due to what? This could happen due to poisoning. This also could be happening due to some obstruction of vessels. There is stasis of bile here, which could be observed due to lack of normal functions of the kidney. What else? The glomeruli are not affected by the process. We're now deeper in the cortex, finishing and going up to the pylon, according to me. Yeah. So let's go back to the cortex again. Majorly, that is what you should be able to observe. There is also some stasis of erythrocytes in the vessels with increased vessels. And pretty much those are the distal tubules, which are kept healthy because they're nucleated. And the proximal ones have lost structure. Pretty much that's it about this type of disease. Now, what could be the reason for this one? We mentioned. What else? Can you guess of other reasons for this type of disease? Sorry, guys. What do you mean by cardiac arrest? Do you mean heart failure? Yeah. Well, heart failure leading to kidney failure, not exactly. First, it would. What were the changes due to heart failure in the kidneys and in the spleen? Do you remember these? Due to right-sided heart failure, chronic one. That is induratio cyanotica. High pressure would lead to hyalinization. And induratio cyanotica in the kidneys and in the spleen would be due to chronic right-sided heart failure. So it would be appearing in a different way with the fibrosis and with the stasis of blood, which would be causing the bluish appearance of the organs. That is why we call it cyanotica. Severe ischemia is what could cause this condition, and also poisoning. That is another reason for this condition, which we already mentioned. Okay, questions about this slide?